Hi everybody, how are you? It's Dr. Emily from the Evidence-Based Fitness Academy. Want to take a few minutes to speak to you about Hammertoes. And why you want to think about Hammertoes is because it does play a role in the overall function and muscle activation patterns of our clients, athletes, and patients. We know that everything is integrated, so of course our toes or the presence of Hammertoes is going to have an impact. When presented with Hammertoes, first question you want to ask yourself is it rigid or is it flexible? Now when we have rigid Hammertoes, these are Hammertoes that stay contracted, all of the digits stay contracted, even when that client or patient is non-weight bearing. If you were to take the digits and try to pull them straight, if they have rigid Hammertoes, they're not going to move at all. It's almost as if those joints are fused. This would fall under something that's a little bit more structural, that it really the only way to correct those would be with surgery. That's going to be a little bit different than what I'm going to speak about today. If you have flexible Hammertoes, or maybe you even have Hammertoes in a client or patient that they're not even present when they're open chain or non-weight bearing, but as soon as they start moving, those digits dynamically contract. That's what we're going to be focusing on. Now there's two types of Hammertoes that are considered functional or dynamic. There's going to be a Flexor Dominance and there's going to be an Extensor Dominance type Hammertoe. The Flexor type dominance are typically present when the client or athlete does anything that is plantar flexed. So let's say they're doing short foot. When I teach in my workshops, a lot of people will start doing short foot and they're going to see their digits buckle or contract in. That's telling me that that client or patient has a Flexor Dominance type of Hammertoe. This means that the long flexors that come into the digits is overpowering and taking over the small intrinsics, which are trying to keep those digits stable. This is following along our deep front line, and it's a muscle imbalance that's actually really difficult to reverse. What I will do in that case, though, is tell those clients or patients to release and inhibit the extrinsic muscles that are in the lower leg and then activate the short foot. The way that you want to activate short foot in a client who does have this Flexor Dominance is to just be a little bit more relaxed or passive. You can even start to engage short foot or those flexors with a forward lean. So if you stand with your feet shoulder width apart, keep the body stable, of course abdominals engaged, and you just start to lean forward, you're going to start to feel your flexors root in or grab into the ground. That's as much activation as you need. You don't need to be really aggressive and drive those digits down as strong as possible, because then that actually kicks in that Flexor Dominance. Second type of Hammertoe is going to be an Extensor Dominance. So this means now the muscles on the top of the leg are overpowering the intrinsics that help to keep the digits straight. Where you typically see this Hammertoe be present is when the client or athlete is actually picking up the foot, swinging the leg through when they're walking, or what's very common is when they squat, you'll actually see the digits contract and lift off of the ground. So if you've ever seen that in a squat and wondered what that is, that's an Extensor Dominance. Now this Extensor Dominance means that the extensors are actually overpowering the tibialis anterior when they are dorsiflexing or picking up that foot. It's something that can lead to a lot of issues up the rest of that anterior chain, so it's something that you want to think about. Where structure or foot type actually plays a role in this, which is not that common or thought of, but is very important, has to do with foot type. Now, when you have a very high arch, what that does is that changes your metatarsal declination. So if we look at this foot model, the declination of the metatarsals, the angle down that this metatarsal has in this specific foot type, has a certain angle. The higher the arch and the sharper that met declination angle, the more mechanical advantage you give to the extensors. So if you have a client that has dynamic extensor dominant Hammertoes and a high arch that is structural, that means that that is a structural driver, and it's something that you cannot completely reverse. You can't just keep inhibiting the extensors and think that it's going to stick. They have a structural driver. So again, remember that structure always drives or trumps some of those functional imbalances that we see. So again, to recap, Are those hammer toes rigid? Are they flexible? If they're flexible or dynamic, is it an extensor dominance or a flexor dominance? And then understand the functional impact of both. Does it mean to stop doing short foot or stop doing some of the exercises? No. But can it play an important role in your programming? Of course. I hope that you enjoyed, and remember, always stay barefoot strong.